So, does masturbation have any effect on a man's fertility or sexual performance? Now, this is a question that I get in my comments section a lot. And of course, I have one of my favorite doctors joining me on my channel today. Dr. Patel is here once again. He's a urologist who's got the scoop on everything you need to know when it comes to men's sexual health. Doc, so good to see you again. I hope you're well.
Thanks for having me on.
Awesome, awesome. Alrighty, so let's jump right into this conversation. I mean, this may not necessarily be a medical question, but from a medical perspective, is masturbation an okay practice for men?
Yeah, it's a good question. I see it all that, I definitely ask a lot of patients because I think it does have some impact because ultimately it really is such a wide ranging question. Well, what does frequency mean? Is it once a day, twice a day, 5 times a day? Like there are certainly patients who masturbate extremely frequently, and then there's some who don't, and then there's everything in between. So I think it ultimately depends on how frequently do you do it? Is it impacting your day-to-day life? And when it comes to sexual practices, is it impacting that? Because masturbation and sexual practices can certainly be linked.
Right. So how often is maybe considered normal?
Yeah, and that's always tough, right? Because everything's so normal based on the person. But typically, I would say in my experience speaking to patients, typically once or twice a week tends to be the most commonly answered question.
Mm,
There's going to be patients who are like every other day, but that tends to be the more common situation.
right. And can excessive masturbation lead to any physical or, I don't know, sexual health issues?
Yeah, certainly no long-term health consequences of frequent masturbation. I think the issue that it can face is that there are patients who will, because of masturbation, have issues with sexual like activity when they're having penetrative intercourse. And that could be because they're unable to mimic the same level of stimulation. When people are masturbating, I often, when I ask, especially young patients that present with erectile dysfunction, is it with masturbation or penetrative intercourse? And when they say that it's only with penetrative intercourse, it kind of makes me think, well, is it because you're not getting the same level of stimulation that you're giving to yourself during intercourse? And I think it's trying to identify those sort of relationships with the patient and really getting them to see that, can you see how this masturbation may be having an impact because you're just not mimicking it? Maybe you're not able to provide the same level of sensation. So I think certainly in that capacity, it can have an impact.
Mm. And would you say maybe frequent ejaculation that often comes with maybe excessive masturbation could affect a man's fertility? Is there any correlation whatsoever?
Yeah, absolutely. So when it comes to extremely frequent masturbation, so they're everything like everything else, everything's a fine balance, right? So when patients have intercourse too infrequently, that's also not good for fertility. Like ideally around the fertile window, patients want to try with their partners every other day to try to conceive, trying to time ovulation and doing it on the set regimen. But if you're masturbating and then trying to have intercourse on the same day, it may have cause an impact to the overall amount of sperm that's being produced. So making sure that it's not happening too frequently can also cause some problems when it comes to fertility.
Okay. Apart from masturbation, are there any other causes of male infertility?
Yeah, so when it comes to male infertility, so just to kind of give a overview, so 1 in 6 couples struggle with infertility. So that's trying to conceive regularly for a 12-month period. And up to 50% can be a male factor. Now, when it comes to male factor, what are some common things? So one could be varicoceles. So varicoceles are dilated veins that essentially expose the testicle to heat. And so the sperm, like the testicles, they want to be outside the body because they want to be in a cooler climate. So these varicoceles are basically exposing the testicle to 24/7 hours of heat and then causing not only issues with the sperm concentration, the movement, but also the DNA of the sperm.
Hmm.
Men who have low testosterone can have issues with fertility. And then there are other medical conditions that men can have. So they could have a history of mumps where they can develop blockages that
Hmm.
sperm may not be able to exit. And then there's a whole slew of other common conditions or other conditions that can cause issues with fertility.
Okay. And what are some of well, based on the ones you just mentioned, what are some of the treatments, they can look at, for instance, when it comes to this varicocele treatment or condition that you talked about?
Yeah. So anytime I see a patient who's struggling with infertility, so number one, we want to get to semen analysis. So that's a semen study. So basically, they'll go to one of the labs, provide their sample, and then in that evaluation, it'll look at the volume of the ejaculate, the motility of the sperm, how much sperm is there, and the shape of the sperm. And we
Okay.
typically want two samples because there's quite a bit of variability. Once we get those results, and then making sure that there is sperm present, because some men do not produce sperm at all, then we'll do hormonal tests. So we'll look at some of the hormones to see whether this is caused by low testosterone and some other hormones that are specifically there to help with sperm production. And then when I see them in person, we'll do that physical examination just to confirm, is there any varicoceles present? Is there any tumors of the testicle? Are there any other anatomic issues? Like some men may not even have their vas, which is the tube that delivers the sperm. So
Okay.
there are conditions like that where people are born with that we can identify on physical examination. And then when it comes to treatment specifically of those varicoceles, so if men have low sperm counts and they have varicoceles and we're thinking about treatment, the most common option is surgery, where we'll actually make an incision in the groin region and then we'll tie off those abnormal veins to improve the circulation to the testicle.
You made a comment. You said some men don't produce sperm at all. I want you to elaborate on
Yeah,
that. And I
I
guess,
don't. It's a very, yeah. When you open up this can, it can go in so many different ways, and it's when it comes to men who don't produce sperm, and so that's a condition called azoospermia. That means there's no sperm in the ejaculate.
okay,
And so when men present with azoospermia, they wouldn't even know because they're still producing ejaculate. Because if you think about patients who've had, say, a vasectomy, right, they still ejaculate normally. So only a small proportion of the fluid when you ejaculate is actually sperm. The rest of
right.
it comes from somewhere else. That's a nourishment for that sperm. And so you wouldn't know that you have no sperm. So when after you've been trying for say a year or 2 years, then you finally get tested and then your mind is blown away, right? You're saying, "Oh my God, how did I didn't know that. I still ejaculate." And that's because very little of that ejaculate is sperm. So then when you have azoospermia, we need to differentiate between there's two main types of azoospermia.
Mhm.
There's a non-obstructive azoospermia and then obstructive azoospermia. And what that means, that non-obstructive azoospermia is because of a production issue. The testicles are just not making enough sperm or they're not making any sperm to get out. And then there's obstructive azoospermia. And think of that similar to like a vasectomy, right?
Okay.
You've made sperm, we're blocking it from coming out. And so these individuals, they have some sort of blockage. Now, where is that blockage? That's where we have to figure that out.
Hmm.
And the blockages could go from not having VAS at all, that you were just not born with VAS, or it could be from an infection that you had that causes a blockage and the sperm can't get out, similar to a vasectomy.
Hmm. Hmm. That's interesting. Thank you for that information. So, then just coming back to like the crux of the conversation, masturbation, and let me get your medical opinion. Frequent masturbation, is this good or bad for men when it comes to the context of fertility?
Yeah, I don't think as long as it's being done, in a reasonable frequency, right? As long as it's not having an impact on your ability to have intercourse, right? So there are patients who, say to me that they're unable to perform, especially when they're trying to conceive. And then when you start asking them about their masturbation practices, the frequency of it can have impact on that, right? If
Mm.
they've masturbating quite frequently and they're just not in the mood, or if they're stressed out about trying to have a baby, that's going to have a negative impact on their ability to conceive. So certainly, if it's I think it's just trying to find those links and whether the frequency of it is having an impact. Now,
Right.
is masturbation going to cause any long-term problems? And the vast majority of people know, right? Like there's no long-term problems with it. It's more of just if the frequency of it is causing other problems in the relationship and their lifestyle and so forth.
And before we wrap up this video, does masturbation exacerbate something like erectile dysfunction?
Yeah, I would. So that itself will not cause erectile dysfunction. I think the problem that people will face is kind of how I talked about those younger patients, is that they're getting used to that level of stimulation
Right.
and that form of ejaculating that they're unable to mimic that in their penetrative intercourse, and that could be the link between that and erectile dysfunction.
Awesome. As usual, thank you so much for your time, Dr. Patel. It's been great. And if you have any questions, guys, don't forget, always just drop your questions in the comments below. I'll see if I can get Doc to, swing by the channel and respond to some of these comments. But if not, you can find him on social media as well. You can go to mhclinic.ca. That's his website. Or you can check out Men's Health MB on Instagram. And I'll drop, the channel ID below this video. So, just go check him out, and I'm sure he will be more than happy to answer any other question that you may have concerning the subject matter. Doc, thank you so much again for your time. And if you like the video, smash that like button so I know, and I'll continue to create more of this content as well. I'll see you in the next video. My name is Jessica. Cheers.